One.
All right, I am looking in the EHR of what patient I need to take care of. I have Myla Bush. She's a female, date of birth 3/28/1945. She's allergic to indomethacin. I'm gonna go to her orders. Looks like she is due for her heparin sodium, 500 units every 8 hours subcutaneously. So I will go back to the MAR, make sure that that's in there as well. So it looks like she is due for this after the 8 hours. And again, it's heparin sodium. It's dispensed as 1,000 units per 1 ml. Her dose is 500 units, so she will receive 0.5 milliliters. Okay, so I have let's see. Oh, I was looking at the wrong heparin. Okay, so I have heparin sodium, 1,000 units per 1 ml. The vial is intact. The expiration is 01/2031. This is going to be a sub-Q injection, so I'll get my supplies for that. Alright, now I'm going to do my first med check. I have Myla Bush, date of birth 3/28/1945. She's allergic to indomethacin. She is due for her heparin sodium. This is 1,000 units per 1 ml. She will receive 500 units, which is 0.5 ml, every 8 hours subcutaneously. She is due for this at 2:37 p.m. I'm going to go to her lab results. Make sure that her PTT is in therapeutic range. And it looks like it is okay to give. It's in therapeutic range. So I'm going to get my stuff and go meet my patient. Knock, knock.
Hello.
Hi, my name's Lainey. I'm going to be your student nurse. Could
Hello.
you verify your name and date of birth for me?
Yes, it's Myra Bush. 3/28/1945.
Okay. Do you have any allergies, Myla?
Yes, indomethacin.
All right. I can see that in your chart. I'm here with your heparin. You're due for it every 8 hours. Have you had this already?
Yes.
Okay. And did you have any reactions to it last time?
No.
Okay, so as you probably know, heparin is an anticoagulant. What we're going to want to do is make sure that you don't have any injuries or get up without assistance and fall. It can cause excessive bleeding, and we do not want that. I'm going to raise your bed up if that's all right.
Yeah.
All right, I'm going to perform my second med check. I have my patient, Myla Bush, 3/28/1945, allergic to indomethacin. I am getting her heparin sodium. She's getting 500 units, which is equal to 0.5 milliliters. She gets this every 8 hours subcutaneously, and she is due for this at 2:39 p.m. Okay. See if that'll bring this up. All right. I'm gonna put on gloves and get this ready for you. milliliters. Okay, I'm gonna check with my other nurse that I have 0.5 milliliters.
Yes.
Okay. And then I'm going to do my third med check. I just drew up 500 units, which is 0.5 milliliters of heparin, sodium. It was not expired with 01 of 2031. This is a sub-Q injection every 8 hours. And she is due for this right now. My patient again is Myra Bush, date of birth 3/28/1945. All right, so I'm gonna be giving this to you in the back of your arm if that's all right.
Yes.
Okay. So I'm gonna look for any injuries or previous injections and clean the area. Gonna let that dry. That's full. Okay. All right, I'm gonna pinch the fatty area, insert at 90 degrees in a darting motion, and inject slowly. Then I'm gonna hold it there for 10 seconds. Okay, are you doing all right?
Yes.
Okay. So I'm just gonna make sure that it's not bleeding. Looks like you don't need a Band-Aid. I'm gonna document and clean up a little bit. And again, I just gave you heparin sodium. Some of the side effects of that can be excessive bleeding, so we want to make sure that you do not fall. If you need any help getting out of bed or feeling dizzy, anything like that, just please give us a call. This was an anticoagulant that can help with any blood clots. Do you have any other questions?
No.
Okay. I'll be back in probably about 45 to 60 minutes to check on you, make sure that you're not having any complications. And I think that should be all right.
Okay.
All right. Have a great day.
Thanks.